ena pilingai nguni maram kama kanguni ngai ka turi daw ngai ka burupan nale ngai le nguni Yolngu course akun maram ngai le nale.
My name's Anne Lowell. I work in the Research Centre for Health and Wellbeing at CDU. For the past 20 years I've worked mostly in North East Arnhem Land with Yolngu and in a range of different areas. But the common theme across all of them has been communication. Communication between Ballanda and Yolngu, either in education, in a range of different areas. What we're focusing on now is communication in health, in terms of encounters between health professionals and consumers, but most recently looking at education processes. So how to effectively share information about chronic conditions, which of course are extremely prevalent in that population. So now we have a partnership with an organisation called the Yalu Marngithinyaraw, which was set up from a research project we did about 12 or more years ago, and it's really a centre for cultural education and research. It's run by Yolngu. There are Ballanda who help and support, but all the people employed are Yolngu, and it's survived over this time. So we're working in partnership with them, so they run the project and we provide support. So most of the funding goes across to the Yalu for them to do the work. Another key feature of the work we do is it's always done in the preferred language of the people who are involved, whether it's an education project or whether it's research. And the preferred language almost always is the Yolngu language. So this most recent project, we've developed 16 videos around chronic conditions, all in Yolngu Mata. And the one we've just finished on cardiovascular disease, there were some old men we were testing it with and they watched it 3 times over a day. And in the feedback interviews we did afterwards, they talked about how this story got into their blood and opened their minds. They were very excited that they had access to this information which they felt they never had access to before. So the approach with developing these educational resources is to integrate very detailed explanations of the Western medical story with Yolngu knowledge and with Yolngu experience. So the medical story is translated into Yolngu Mata, a Yolngu interpreter. Then different people will tell their stories, which is also very powerful and very important in terms of the resource that Yolngu want. So the resources integrate the knowledge and experience from both domains, from the medical domain and the Yolngu domain. People talk about participatory research. It's actually a stronger, more collaborative research. There's a word that Yolngu use, Ral Manapan Mirajama, where every person has a key and essential role, but different. And it really means collaborative practice, and that's the kind of model of research work that we do.